Good morning. Assalamu alaikum. My name is Dean Parisi. I am the Director of International at the American Medical Association here in Chicago in the United States. I am joined this morning by my colleague, Charles Aunger, Chief Digital Officer from Health2047 in the California Bay Area. Charles, good morning. How are you today?
Good morning, Dean. I'm doing great. It's a beautiful sunny day here in Silicon Valley, right in the middle of it, and happy to be with you and everybody there in the GCC. It's probably a bit colder where you are in Chicago than it is in the GCC or here, but it's great to be with you and looking forward to this.
Indeed. It is a cold, blustery day here in Chicago, but nonetheless, we've got a great opportunity here over the next 30 minutes to talk about innovation, and delighted that you're able to join us. So I think the first question, the obvious question is, what is innovation? From your perspective, I think everybody has an opinion or a view on innovation. Many people think perhaps it comes from a eureka moment, an aha moment, or as one that is measured in obvious, gigantic transformations. But again, as an expert who lives and breathes innovation every day with a deep background and expertise in innovation, Charles, how would you describe innovation, and particularly as it relates to our industry, healthcare?
This is something I get asked so much, and it's really hard for people to see off the get-go, because they hear the word a lot, and we talk about innovation a lot. But innovation is how we change the practical reality and look at that creation methodology and development and implementation of new solutions, new processes, new services that improve efficiency, effectiveness, competitive advantage, strategy. And that usually gets tied to the word, like you just said, transformation, right? And transformation and innovation go very much hand in hand. And how that works is, it's how you change what you might have had before, so something that's not really the same or different from you had before, to make that new activated product, marketplace, new methodology that combines all of those things together, that can create a new business concept or a new service or a new way of doing something. And you hear it a lot about Silicon Valley. Why Silicon Valley do a lot of this and been seen as a leading light in innovation for such a long time. But you can see this across the methodology, and the reason being, it's about how we take that step change to a different level. So what Silicon Valley is known and good at doing is looking at that aspect of something that's been brought to them, and literally spinning it around and sitting there and looking at all the aspects of it, and maybe taking it back to a plain sheet of paper, or looking at it and seeing, hey, it's a greenfield market, let's inject something from outside into that greenfield market and change it. And you can sit there and say, this is how Silicon Valley's been renowned for doing what it's been doing. We get good names and bad names, but you can see that every single day. And it's literally, how do we keep moving the dial every day? And it's a good feeling when you actually sit there and come with something that is that thing that is going to make a difference. And we talk about this thing called product market fit a lot, and it's where we literally look at the market and see where that value is and where it's actually going to be an enabler. We have a unique difference from Health2047, that we have a mission to do innovation and transformation that we were given from the AMA. And so that when you marry that up to healthcare, is we have the normal things that are going on in healthcare around payments, coding, and other things. And then you sit there and say, well, how do we look at it going forward? And how do we do that transformation and innovate in a space that traditionally has been hard to access? But the fun thing is that, as you do with the international team and across the AMA, we've now baked that into our part DNA by starting Health2047. and bringing it out in Silicon Valley. We looked around the whole of the United States where we put this, and we saw that here we just had access to people, we had access to thinking, and people that would enable that thinking, and could partner up with our folks at the AHIMA in Washington and in Chicago. And we're pretty proud of where we've got to and where we are with you guys in Chicago and Washington, and how we're now enabling that out further, around the world, especially with you and your team, because that's the way, looking at people and looking at different aspects of healthcare globally, we might find amazing things that we can put together in different places, and that is innovation, right? Yeah. It's the passionate about that people to pick it up.
You're absolutely right, Charles. And we'll talk later in this morning's conversation about our strategic focus, but clearly one of them is on innovation. And you also mentioned we are a mission and vision-based organization. Our mission, as you know, is to promote the art and science and the betterment of public health. So we're looking forward to an inspiring conversation this morning. So Charles, you're in a unique position, given your time in the United Arab Emirates and the work you did previously in Abu Dhabi. What have you noted about the GCC that fosters innovation in healthcare and transformation?
That's really great question, Dean. I mean, there's a really big, interesting scenario that I compare the GCC to from some real specific countries around the world. GCC has some enhanced advantages over some other locations around the world, from the example of preference on mobile technology and prevalence. In the GCC versus America, many people are mobile first. We haven't got the legacy over in the Middle East compared to the United States. So we have a lot of legacy, a lot of older technologies that we have to work around. And looking at how the GCC works compared to people like Singapore and parts of Europe, Denmark, Netherlands, Sweden, it's been prevalent around mobile technology and access to data and access to that information and how that actually changes. The other thing that's been real interesting is how laws have actually been enhanced, and restrictions against laws and preference of how that's happened is way different from what we have in the United States and UK and other parts of Europe. So it's that prevalence of that access to being allowed to use data and networks and digital compared to anybody else in the world.
Mm-hmm. So given that access to data and the transformation, what are you seeing specifically in Silicon Valley that may have significant ramifications on healthcare outside of the US or the UK and in the GCC?
Yeah, that's an even more interesting question. When you look at what we've been doing in Silicon Valley and what you see across the world in innovation really moving the dial today, it's about, again, everything to do with mobile and everything to do with how we enable data to make that business or that strategic advantage, as I was talking about, what innovation is, efficiency. And so if you look at things like that, if we take some data, it's all about how we enable that through AI and information access. And so when you really enhance that innovation aspect, what enables you is the ability to move information and technologies forward by enabling this interconnectivity of new technologies. And it's pretty amazing. You see this in the Far East predominantly. You see this in certain parts of Asia, UK. It's been really prevalent, obviously, in the last year with COVID, how we've actually developed drugs and technologies using cohorts of people that have been digitalized. And so we see that in the realms of adaptation of technology towards quantum, 5G access, but that then enables new things in healthcare that's never been done before. So remote patient access, remote digital access to patient activity. And that's a really big aspect when you talk about things like diabetes, you talk about health, wellness, and things that have been really hard before. And that's really apparent in obviously the GCC with major diabetes surveys that have been done and strategies that have been done over the years. But the interesting problem with all of that's actually a really big overrider that we've seen, obviously, in the last 6-7 months, even more prevalent with COVID, is data security management around all of that.
Mm-hmm. Yes, COVID obviously, as the global pandemic, has been on the hearts and minds across the globe of ministries of health, health organizations, health regulators. And I know the AMA has done some innovative work around the pandemic, and actually leads us to the next subject matter, which is about why is the AMA and Health2047, what is the connection there? And, before we jump into that subject, Charles, I think it's worth sharing with our audience the 4 strategic focus areas or arcs of the American Medical Association. So as a 175-year-old organization, we first of all represent the voice of the physician in a unified manner. 2, we lead the change on confronting public health crises, from diabetes to most recently the COVID-19 and the work we've done there. But again, that second aspect of making sure that we're on the forefront of confronting those public health crises. And 3, removing the obstacles that interfere with patient care, recognizing that relationship between the patient and the physician is a critical one in allowing the patients to spend more time. And some innovations that we've done and some investments around the CPT code set and allowing physicians to spend, again, more time with their patient and less on the administrative side. And the last aspect, which dovetails into today's conversation, is we want to maintain and drive the future of healthcare innovation. We, again, recognize as a 175-year-old organization, healthcare today is different than it was back then, let alone 50 or 25 years ago. So from your perspective, Charles, what are some of the key elements that the AMA is collaborating with as it relates to Health2047, and some of the fundamental issues that we see as adopting technology, not for technology's sake, but again, to improve that relationship between the physician or overall healthcare delivery, whether it be in the United States, in the GCC, or potentially elsewhere?
Absolutely, Dean. The AMA, 5 years ago this week, actually started Health2047. We're a wholly owned subsidiary of the AMA. And people sit there and say, why is the name Health2047? Well, as you know, in 2047, the AMA will be 200 years old. And so the AMA has a unique position in the United States, being looking after a couple of different aspects: the ethics of healthcare, and how the physician actually produce and manage healthcare in the United States, which is pretty phenomenal. If you go and see the plaque in the AMA office, it's pretty amazing, the actual original script saying ethics of healthcare. But fundamentally, then, it's, as you said, it's the four strategic arcs that we map on as the wholly owned subsidiary to what we see as innovation in Silicon Valley. So that's data liquidity, chronic care that we just spoke about briefly. How do we deal with diabetes and change in all this chronic care scenario, moving from episodic to chronic, and radical productivity change. So lots of AI, real-time analytics, data, real-world evidence around the globe, and then healthcare value. And that really maps into this space of how do we do things like startups, incubation, activity, and really map to the innovation arc of the AMA, and how do we change that dial going forward. And what we found is we need to think about new methodologies and new access as if we were thinking out to 2047 and not just now. I think the most amazing thing is how the AMA has embraced that, even with like yourselves and other people coming on, and seeing the activity as a global activity of how we enable things like AI technology, how we do the right information mapping and moving that around by other activities. And the interesting problem is, how do you then benchmark and baseline that? And the AIM has a unique perspective on this, having the access to CPT coding and being able to benchmark and align through the whole messaging flow, actual episodes of care, and actually be able to code that. And that's a really interesting scenario about how we improve outcomes and reliability of data, and look at that as a pivotal aspect as the way global health changes in this new world. And we've seen it even more with COVID, how globalization of health is going to be more prevalent. Apple and other people doing health kits, AMA with CPT going global, us as doing, launching 9 companies in the last 5 years, really specifically doing this, but we couldn't do it without that partnership that we have from our parents at the AMA, and actually doing that and taking that global. So it's a really interesting time around digital technology change in healthcare. COVID's brought a lot of that forward, and it's just going to carry on changing going forward. And it's always interesting to work with our colleagues in the AMA and Washington and see that happen, and really bring forward things like we've done in the last couple of years, enabling CPT for remote patient access. It's been, that's been fundamental in the last year for COVID. And diabetes, the DPP program from the CDC couldn't have been done without the AMA, CDC, and Health2047. So that's pretty cool.
So you're exactly right, Charles. I think as we see the proliferation of technology and understand it, we recognize it's not going away, and the pace of modern medicine is changing. So from a CPT side, right, our focus is on maintaining or understanding those trends, codifying them, whether they're roughly the 70 telehealth or telemedicine codes that we've developed over the past few years, or in the case of COVID-19, roughly the 25 codes from the administration to the vaccine to the tracking, right? Again, making sure that CPT keeps pace with not only technology, but innovation. Also, just with respect to one example, you had mentioned that Health2047 has launched a number of organizations over the past years, and I think you were alluding to first mile care. Can you give us a little bit of glimpse specifically into first mile care and some of the good work that was done there?
Absolutely. So first mile care is the last mile diabetes prevention program. So we've mirrored it on the idea that CVS and Walgreens over here in the United States is a pharmacy, and you can always see a pharmacy on the way home on the right-hand side of the street. And there's always a pharmacy usually within 10 minutes of every zip code in the United States. So it's been real interesting about how we work with this program that's been around for nearly 10 years now. It's called the Diabetes Prevention Program. And what we found was when we analyzed the data, and this was the difference that we did, we looked at it from a Silicon Valley perspective. Take a clean sheet of paper, greenfield, how would you remap this? And remapping it basically saw this methodology that it was all about uptake. It was all about access to actually the patients talking, or the people talking to coaches and having access. So what we've done is transform that access and given them this ability to have virtual coaching or real coaching, and we try to do real coaching more. And we've gone from a 50% retention ratio to 87% retention ratio, and people losing weight, right? So in my example, I've lost 30 pounds in weight since Christmas, right? Since December. And so that is changing the way my life is for the better, right? It reduces my A1C and everything. And so we're seeing these massive results. It's actually been now picked up by the CDC, and we're a certified course and platform to actually deliver this. And it couldn't have been done without the AMA. But this is where we see these healthcare changes that we've seen actually through the history of the AMA on 200 years. We've seen that scenario that says we've moved to more of this from episodic to chronic care, which is just living with these things. And first mile care has been one of these leading lights in this, and we've seen this now proliferate. We've got 5 different states in the United States actually picking this up. It's a delivered program. It's kind of like, let's call it the Uberization of pre-diabetes care, and it works. I think the interesting problem is it couldn't have been done without taking that analysis, that information, working with the CDC, but it actually enabled one other thing. We can see that the stretch of telemedicine is not about telemedicine in its own right anymore. It's about digital access to medicine, and and video is just one part of it. It's more about actually understanding, am I doing steps? Am I doing, what am I eating? When am I eating it? How much weight loss, and can I monitor that every day and send that information to somewhere, or even just speak to somebody? And in the last year, that's been really paramount for a lot of people. mental illness, unfortunately, is a big deal around the United States, and that's where we're seeing some next steps in this sort of thing. But First Mile is an awesome crown jewel that we're both proud of at the AMA and Health2047, and the CDC loves it as well. I think it's very easy to model around the world, and have that reflection of the professionalism of the AMA's actual professional history and records, and the standards that we can bring back to that innovation, efficiency, access, transformational, to the way that we now trust new technologies and deliver that scale, because populations different around the world, populations have changed. And then once we've figured that out, we can start integrating and doing new things with the information we're getting.
Charles, we have only scratched the surface of innovation. Obviously, from your home office there in San Jose, in the heart of Silicon Valley, you probably see a number of different, from investments to opportunities to technology advancement, stuff that is way out in the future, or items that perhaps the common person may not be privy to. So based on your experience as the Chief Digital Officer and what you're exposed to on a daily basis, we talked about 2047 being the 200-year anniversary of the AMA. If we look out into 2047 and you look into your crystal ball, what predictions would you make, or what observations would you make today that we would expect in 20 to 30 years?
I think if you look out, and it's quite amazing where you see automotive and access to transportation has been a big guiding change over the last 100 years, and globally that transformation is happening. It's being electrified, it's being automated, etc. But that's coming from movement in technology and transformation and innovation in technology about silica, AI, data access, right? And as that data access changes and we enable new bandwidths, right? Prevalent now in Silicon Valley here is 5G. I get 120, 130 megs to my phone, megabits per second to my phone all the time around Silicon Valley here. That's transformation. I can run applications now and different things really, really fast. And as we stretch the edge technology that we can have actually out to the consumer or person using it, because the consumer has some connotations that you're buying lots of things, not necessarily there. We enable all of this transformation in access to information and around the world. So it's going to be areas where we can see more use of prevalence of AI in the future. I think now we've proven video works, and access to remote different situations is not now a blocker for people to use different things. We also will see new technologies around microchips that are obviously continue to shrink that footprint and making the mobile devices even more powerful and more accessible. Earphones, etc., just the starter of where that is. But the new wearables now will be able to detect disease and other things in the future. Massive advances in that in Japan and Taiwan and other places. But all of it is predicated about access and different aspects. And I think we will be able to create the ability to diagnose and treat patients and people for more chronic care over the next 20 years versus people thinking certain things are life sentences or don't know what it is, because we'll be able to see the life history of many, many people and use that information to actually figure out how we change disease cohorts and actually probably get rid of some diseases that actually have been around for a while. But we'll also see new things like COVID. The world has always been able to create new things. And we're at the cusp of where I am is the luckiest job in the world from the perspective inside the AMA, seeing bleeding edge technologies every single week from car manufacturers, etc. And look at that and how we will enable that into healthcare. Even could be automated ambulances in the future where you dial somebody and take you to the hospital. So AI is going to make that difference. Data is going to make that difference. Countries like the in the GCC are prevalent in that space on digital cities, China, etc. we're going to see that, and it's just going to be, I think, way more like the movies than you've ever seen before.
Yeah, Charles, this has been a thought-provoking and stimulating conversation this morning. Unfortunately, our session has come to an end, but did want to thank you. Also want to thank the organizers, AHIMA, for a successful conference. We have a few hours left if anybody's interested in continuing this conversation with myself or Charles. Our contact details are going to be made available. We also have a digital booth, again, that is open for several more hours, where you could come and chat with us and have an extended conversation about Charles around innovation or things that you may be doing within your organization. Again, on behalf of the American Medical Association and Health 2047, thank you and have a good rest of your day.